All right, we're here today with Angela, and Angela is in the office for two different issues. You came in for your knee, and at the time your neck wasn't bothering you. So when you came in for your exam, now all of a sudden your neck is bothering you. So we're going to work on your neck first. So tell me a little bit, how did it start?
My neck?
Yes.
Well, I get this every once in a while for a few years now, about 3 or 4 times a year, and it would be gone in a couple of days. But this time I had it for 3 weeks, and it just doesn't want to go away.
So explain to me where it's hurting.
Okay, it's hurting like, it starts over here, and then it goes all the way up the back of my neck, and it goes around the back of my head.
Okay.
And this really hurts. And if I kind of tap my head, it kind of feels better.
Mm-hmm.
If I play with it, or
So how would you describe the pain that you're feeling? Is it like a dull ache? Is it a sharp shooting pain? How would you describe
I
it?
would say more of an ache.
It just won't go away.
It won't go away.
And you're just not comfortable.
No, it's very uncomfortable.
Yeah. Is it affecting your sleep?
Yes, and then it hurts, and I feel like crying.
Sure.
And then I took about 3 aspirins, and first I was taking 1 aspirin, then I was taking 2. Then I said, let me just take 3 aspirin, but it would not go
And
away.
it's not even touching it, is it?
No.
Okay. I'm going to have you do a couple movements just because I want to see how you're moving your head. So your first movement, if you could put your chin to your chest. Okay, and lift your head back up. Any discomfort when you did that?
No.
Okay. Now I want you to look all the way up to the ceiling. Put your head back as far as you can. Look up at the ceiling. Okay. Any discomfort when you did that?
No.
Okay. I'm going to have you turn your head to the right as far as you can. And that's as far as you can? Okay. Do you have pain there?
No.
Okay. Turn your head as far as you can to the left. Right there. Okay. You having pain when you do that?
A little bit, yes.
Okay. Is it shooting all the way up to the top of your head?
Yeah, like I said, it comes and goes. Like right now, it's starting again.
And it's certain positions that your head is in, and it just starts throbbing.
It triggers it, yeah.
Exactly.
Mm-hmm.
All right, well, let's go and get you started and get you feeling better. Welcome aboard, Angela.
1, 2, 3, 4, 5, 6, 7. Relax. Good. Ready? So press on my hand. Press on my hand like you're turning to the left. Beautiful. So 1, 2, 3, 4, 5, 6, 7. Relax. And now we turn. Good.
We're back with Angela, and Angela has finished her treatment for your neck. So Angela, we're going to do those same exercises again. If you could put your chin to your chest, put your head up as high as you can, as far back as you can. Okay, all the way to the right, and then all the way to the left. All right. So Angela, tell me, what changes have you noticed?
Oh, it doesn't hurt me.
The pain is gone?
Yeah.
Because what did we start off with your pain level? Was that a 6 or a 7?
Yeah.
And what do you think it is now?
I don't think it hurts at all.
The pain is gone. And I know you said it was going up the side of your neck to the top of your head.
There's nothing there now.
There's nothing there. And you said even sometimes when you would tap it.
Yeah.
So it's gone?
Yeah, there's nothing there.
That's fantastic.
Uh-huh.
So are you happy with today's visit?
Yes.
Yes. And look at that smile on your face. That's what I'm talking about. Well, the next visit when you come in, we're going to start working on that knee. We got one problem solved. We're going to be working on the second problem. All right, Angela, welcome to the family.
Thank you.